Welcome to Midlife Matters. I'm Marie, and each week I'm joined by my friends Julie and Mindy to talk about all the topics keeping women in the middle years up at night. Today we're talking about ways to alleviate symptoms and how to feel more like ourselves during perimenopause. Join us as we talk with Dr. Joy Baker about hormone replacement therapy, nutrition, and the benefits of utilizing both traditional and functional medicine. Listeners, today we have a special treat. We have an interview with Dr. Joy Baker, and we are going to be talking about all the questions that midlife women want to ask a gynecologist. We're just going to be asking them all. So let's just say right from the beginning that is what this podcast is about, and I think it's going to be awesome. Mm-hmm. But we do have a lot of questions to ask Dr. Joy Baker. And so, Mindy, why don't you introduce Dr. Baker, because you brought her to us.
I'm so excited to have Dr. Joy Baker with us today. From the moment I moved to town, I saw her lovely face in magazines and local advertisements. And then slowly but surely, I was able to meet her at different community events and just really am very fond of everything that I have seen. So let me just go ahead and introduce our guest today. We're excited to have her with us. She is an OBGYN practicing here in LaGrange, Georgia. She's also recently opened up a clinic called Renew Infusion and Wellness, which I will be asking her about also towards the end. She is an active presence in our community. She's always uplifting, educating, encouraging. I mean, I can't give enough positive adjectives to all the things that she is. But we're excited to be interviewing her today, not only as an expert in women's health, but also to hear more about her personal story and all the ways that she brings joy to others. Joy, welcome. We're so glad to have you.
Thank you so much for having me. I'm super excited to talk with you guys about all sorts of things that have to do with becoming a woman of a certain age, a middle age, which is where I am right now.
Okay. Well, we're excited to talk with you too.
Well, Joy, why don't you start out by telling us a little bit about yourself?
Well, I'm a board certified OBGYN practicing in LaGrange, Georgia. I've been here for about 4 years. I've been in practice for 10 years. I can't even believe that it's been this long. I really have a passion for quality and safety in women's health. So I do a lot of work at our local hospital, being the director for quality and safety and the department chair. So I get to interact with all the different docs and look at how we make care safer and more efficacious for women in our community. So I have started to really get interested in menopause and midlife for women. So perimenopause, menopause, and kind of what happens during the pause. Mm-hmm. And so I'm really excited to talk about that today. I love opportunities to educate women. Actually, during the pandemic, which happened a few months after I moved to LaGrange, I started a YouTube channel called Delivering JoyMD. And it was really for the purpose of connecting with and educating my patients and women in general. So I'm excited about that. And it's done really well and people really love it. And so over the past year and a half, we've been featured on the local BTV network. So I have a Well Woman Wednesday segment every Wednesday at 1 p.m. So we talk about all the girl things that women need to know. And it's just been a lot of fun.
Oh, that's great. That is so cool. I'll have to check that YouTube channel out for sure. You said you've been practicing about 10 years. And so I was wondering how you got into this field.
Oh my gosh, that's such an interesting story. So in medical school, I started out wanting to do general surgery and probably specialize in plastics. And towards the end of medical school, I got a taste of trauma surgery and critical care. And so I had already applied for my residency, which is your first job out of medical school, at several places for general surgery. I was the president of the surgical society. I had, just was very gung-ho about general surgery until one day I was doing a trauma internship in downtown Atlanta. And it was a Sunday and it was about 11 o'clock. And this gentleman came in with a gunshot wound to his back. And we ended up taking him to the operating room and removing his kidney, which was shattered by the bullet. And so I just remember standing there and looking at this kidney lying on the surgical table and thinking to myself, this is not my life. Like, I don't want to do this for the rest of my life.
Wow.
And so I went to my medical school dean. And at this time, I was halfway through my senior year, or my fourth year of medical school. And she had told me when I was a first year medical student, you go and sit down with her at the end of your first year, and she's called the Oracle, like in the Matrix, and she tells you like what your specialty is going to be. And when I sat down with her, she told me that my specialty would be OBGYN. And I was just like, you're crazy. There is no way. Like, and so in my second year, she would always match me up with these OBGYNs to go to do my clinical studies with. And I would be so mad. And I'd be like back in the corner, standing in the corner, like, and the doc's like, can you see what I'm doing over here? Like, this is how you do a PAP. And I'm like, yeah, I'm good. I'm right back here in the corner. I don't need to come any closer. But, it just so turned out that at that time I felt really, really lost because I was so gung-ho about surgery. And she suggested to me to go and spend some time with a gynecologist who did a lot of pelvic surgery. And that's how I found my niche. I found my joy. I also found that, when I was doing interviews for general surgery residency programs, people were like, you don't need to wear the sparkly lip gloss. You don't need to do any ruffles, nothing pink. Like, basically, it was sort of a mandate to kind of change your personality to be able to fit in with that specialty. But when I decided to start interviewing for OBGYN residencies, people really were like, oh my gosh, those shoes with the ruffles are so cute. Like, it was really like much more my people. I felt so much more at home. I like to do things like bake muffins or cupcakes and things for when we had our department meetings. And in general surgery, that was somewhat frowned upon. It really wasn't the culture. So it just turned out that she was absolutely right. OBGYN fit my personality. And I'm so glad that that this is the field that I'm in. I love my job every day.
Oh, it's so great.
And Joy, it is so evident that you love your job. And I love that you're sharing so much already. We have yet to even tap the surface of what you're going to talk to us about today. But I think it's evident that you look at the whole person. You're not just doing a job. This is your life. This is your passion. And I would love if you would just kind of give us your overview of women's health in general. You're always looking at the whole person, not just the medical. So could you give us your views on that?
When it comes to women's health, and the reason I really love women's health is because, women are the center. We are the center of families. We're the center of communities. I like to think that we're the center of the world. And the thing about women's health is that if you can teach one woman to live a healthier life, to make healthier choices, then her family is going to be healthier. Her friends are going to be healthier. And she's going to help her community be healthier. Like, if I teach one woman just some small tidbit during an office visit, she's going to tell everybody. She's going to tell everybody that she knows, and she's going to try to help everybody that she knows live a healthier lifestyle. And so that's one of the reasons that I really love women's health. I think that a good measure of the health of a society is the health of its women and children. And so that's exactly what we do in the obstetric part of our job as OBGYNs, is to take care of families who are preparing to birth. And then we take care of women throughout the lifespan. And so I really do believe that women are the center of our communities, and we have to take good care of them, make sure that they understand their bodies, they understand their health, that they're able to impart those healthy habits to their children and their husbands and their, the other people in their family and their community.
I want to go ahead and delve right in, because you have just opened the door wide open to exactly where Marie and I are hoping that you're going to take us next. And that is, we are all aging just as gracefully as we possibly can. We're in midlife right now, and we need all the help that we can get. I mentioned earlier, you are our expert. on this subject today, much more expert than Marie and I, though we are always talking about it. So is there anything that we can do, first of all, with foods, exercise, vitamins, supplements, minerals, to help kind of ease some of the symptoms of, and let's just start with perimenopause.
Perimenopause, and the backstory to this is that what's happening is that we are running out of estrogen, and we're also running out of those follicles in the ovary that would produce eggs. So that's really what causes a lot of these symptoms, is that the downregulation of estrogen. And so when we talk about hot flashes, estrogen helps to control our vasomotor center of the brain. So that the area in your brain that controls your body temperature is not working as well anymore. So hot flashes, you may have difficulty sleeping. You might have problems with vaginal dryness, lower libido. You may have lower energy. Some women even experience joint or bone pain, brain fog. And fatigue can be a real serious thing. Thinning of the hair, drying of the skin. Like, it seems like, maybe the world might be over when you're starting perimenopause. A lot of folks come in to see me and they're like, "Oh my God, I'm falling apart. Like, this is awful." But a good friend of mine who is a menopause expert, her name is Dr. Joy too. Her name is Dr. Joy L. She talks about the power of the pause. So this is essentially our bodies going back to what they were before puberty. So we're basically experiencing puberty in the reverse. And so this is a time to pause, evaluate where you are, where you'd like to go, and what you want the last half of your life to be about, and how you want to live that. And so I really encourage people to sort of change their attitude about it, because we often think, "Oh my gosh, I'm getting old, or I'm falling apart, or this is wrong, or that is wrong." But really what we're doing is we're moving into a new frontier of our lives. And so it's an opportunity, I think, for us to look at it that way. And so when we talk about how we can, age as gracefully as possible, or transition into this new frontier as with as much ease as possible, we want to think about our diet particularly. A plant-based diet can be particularly helpful because plants have phytoestrogens. And so those are natural estrogens that occur. And so when you're having those in bulk, that can be helpful with some of the symptoms that people experience during menopause. Exercise at least 2.5 hours per week, which is the recommendation from the American Heart Association, can also be very important, not only to help you avoid those menopausal weight gain that we see all the time. A lot of women gain those extra pounds, those pesky pounds that usually happen around the midsection. So exercise can be helpful for that, but it also can be helpful to improve and stabilize the mood, and to help to keep your brain sharp. So we know that those connections in our brain benefit when we exercise and we stay active. So diet and exercise are huge things. There are some things in our diets that we could cut out or avoid too, as well. Like a high carbohydrate diet has been associated with worse hot flushes. If you're taking in a lot of caffeine, that can be a problem as well. So you want to just sort of think about the things. Spicy foods can precipitate hot flushes. So you want to think about the things that you're eating in detail as you start to experience perimenopause and menopause.
All right, Joy. I turned 51 in May, and it seemed like as soon as I turned 51, like everything that you've ever read in a book all of a sudden started happening to me. And before that, really nothing was happening to me. So it really honestly was just like a switch. But one thing I'm very interested in and have been doing a lot of research on, and have 2 different doctor's appointments this fall to go and talk to someone about with 2 different doctors. I'm trying to poll and get opinions. So I'm trying to find out about hormone therapy, because my mom was of the generation, I think, that was scared by the Women's Health Initiative and just kind of toughed it out. But I don't know that I want to just tough it out. And it seems like the research has kind of shifted and said, like, we didn't really analyze that Women's Health Initiative study the way we probably should have. And there probably are some hormones that we can provide. And so how do you feel about that during this time?
So I'm glad you have a couple of different visits coming up because I can tell you, if you ask 5 GYNs, you'll get 5 different opinions probably.
Okay.
um, one of the great things and one of the challenging things about the American Board of OBGYN and the American College of OBGYN is that they leave a lot of things open to your clinical judgment. So,
Mm.
so it's, but I personally am of the, I don't believe in suffering and, toughing things out. I think that if you have significant symptoms that are caused by menopause, you should treat that because quality of life is also very important. And so with the Women's Health Initiative, there were a lot of confounding things in that study that came out. And now that we've sort of gone back to look at secondary findings of this huge study, we realized that there were some things that probably we didn't get right that first time. And so, for one thing, many of the women who were involved in that study were much older. Some of them already had underlying heart disease. Some of them were smokers. Like there was a whole bunch of stuff that was confounding the data from that study. And so then you're looking at the arm of women who were taking estrogen alone, and then the arm of women who were taking both estrogen and progestin. And it really looks like the majority of people who had adverse outcomes were in that estrogen plus progesterone arm. Now, progesterone is a hormone that's made by the ovaries, and it is very important. It's a very important part of hormone replacement therapy if you still have a uterus. But there are many ways to replace progestin. So for some of my patients who are older than 65, which many of the women in the Women's Health Initiative study were older than 65, then I offer them some additional options for replacing progesterone if they still have their uterus inside their body. And one of the ways I do that sometimes is just with a low dose IUD, which acts locally, just right inside the uterus. And then we can continue their estrogen therapy with a patch, a pill, pellet, whatever therapy they've chosen. And then that makes it a lot safer. 65 years of age is about the time that we think that the risks begin to outweigh the benefits with hormone replacement therapy. And so women who are, in their late 40s, early 50s, like in that first 10 years of menopause or perimenopause, can significantly benefit from hormone replacement therapy if they find that they're having significant symptoms from their menopause.
I guess part of me, maybe a vain part, but I'm sure other people wonder this too. Even if I wasn't having significant symptoms, what would be the harm in taking the hormones at least through age 65? Isn't that going to slow down like your skin aging and all these other, symptoms that you gave at the beginning of the podcast? Wouldn't that just slow all that down? And what would be the harm in continuing that just out of I just want to feel like myself?
Well, I think that, again, it comes back to quality of life. And so if you're not feeling like yourself, even if you're not drenched in sweat every 10 minutes from a hot flush, or even if you're not, experiencing significant depression, fatigue, or brain fog, if you're not feeling like yourself, then that's a quality of life issue. And so there is not necessarily a harm. Like if you feel like I'm looking old and haggard, my hair is thinning or whatever, this is about the quality of life. Because menopause hasn't killed anybody, right? Like nobody dies from these symptoms.
It's a slow death.
You might feel like, I know, right? It might feel like death by 1,000 cuts, but it's not. But what it becomes is a quality of life issue. Like, am I reaching my full potential as a human right now in this phase of my life? And if the answer to that is no, then, hormone replacement therapy, if you are a good candidate for that, is certainly an option. It's definitely an option, particularly in that first 10 years of menopause. And so 10 years is kind of sort of like the number of years that average that we would expect, that someone would be on menopause or on hormone replacement therapy. And usually after the 10-year mark, it really needs to be what we call a doctor-patient decision that we make
Mm.
together, or what's called shared decision making.
Mm-hmm.
So I have people that have been on hormones way longer than 10 years, but at the 10-year mark, it's time to sort of stop and reevaluate and say, okay, do we think we might need to taper this down? Do we think we maybe want to come off? But 10 years is sort of like the number that we think is probably safe.
Okay.
And certainly those women who are earlier in their course, like in perimenopause or menopause, tend to do better. And when we talk about like side effects or potential harms, you have to think about each person individually. It is very much an individual thing, because each woman has her own unique hormonal milieu. And so, you have to think about, okay, well, how much hormone therapy will this person potentially need? What do we think some of the risks may be based on their personal family history, or the history that they've had, their medical history? So you kind of need to look at each person individually. And so one thing I like to do is to actually have a consultation with folks and say, okay, let's look at your health history. Let's look at how you've done in the past on hormones, like if you were ever on birth control. Did you experience any blood clots in the legs or the lungs on birth control pills? But did you ever have to be taken off of estrogens before in the past? So there are lots of things that can play a role in that. Do you have a family history of estrogen positive breast cancer? Ovarian cancer. So these are all things that you want to think about. Did you have assisted reproductive therapy like IVF, where we, kind of pumped you full of lots of hormones in the past? So there's lots of things to sort of consider when you're making the decision to start hormone replacement therapy. But the vast majority of women are good candidates. So, there would be a rare, a rare instance where someone would not be a good candidate for hormone replacement therapy. But for the most part, women in general can meet some requirements for some form of hormone replacement therapy.
Yeah. And so I'm, like I said, 51. It just was like all of a sudden a switch in my body. So I haven't had my menstrual cycle now in like 4 or 5 months. I'll probably get it, again, but I haven't had it at all. Do you have to wait 12 months? Because that's what you sometimes hear. But I'm wanting to start earlier than that. And I could get a period again at 11 months and then have to start that whole year clock over again. So when can you start it?
So you can start hormone replacement therapy even in perimenopause.
Okay.
So and perimenopausal bleeding is one of the biggest reasons that we, in midlife, that we place folks on just, a regular birth control pill, just estrogen or progesterone and a birth control pill. And so you can certainly use that to sort of bridge that gap during perimenopause. And that's probably one of the easiest ways to do it. But you could also, if you needed additional estrogen, progesterone, you could certainly go with some of the menopausal treatments that are out there. And there's sort of two big schools here. You have your compounded hormone replacement therapy, and then you have your standard market FDA approved hormone replacement therapy. I'm not of the opinion that either one is bad. I think that it really depends on the person and their unique hormonal status, and how we can actually help them get to a place where their quality of life is good, or what they expect.
Okay. So this is like a magic thing that I never knew about, vaginal estrogen cream. So I have been hearing about this on a lot of podcasts that I've been researching about for menopause. And this is my understanding, is that even if you didn't want to take systemic estrogen, that this can be very beneficial to keeping the tissues healthy, avoiding UTIs, avoiding the thinning, avoiding the dryness. And no one that I ever knew has ever mentioned that. Now, maybe people have been on it for years and just haven't said anything, but I definitely feel like this seems to be something that all perimenopausal women should be thinking about. Do you often prescribe that?
Oh, every day.
Okay.
All day. I love vaginal estrogen cream. It's like one of my favorite things.
Okay.
So yes, every day, all day. And the great thing about vaginal estrogen, even if you're spooked by the Women's Health Initiative or by something that you saw a friend or family member go through, vaginal estrogen is safe. It's like super safe. So you can use it like, it's like Red's hot. It's like, what's that Red's hot sauce? Put it on everything,
Oh.
put it on everybody. Because it does help to keep the pelvic floor tissues healthy. It does help to avoid the thinning of the rugae, the little folds in the vagina, which can lead to tearing and painful intercourse. So I love vaginal estrogen. If you've got pelvic prolapse, it's really good to make sure that those tissues aren't getting dry or denuded. I love it. I have like pretty much most of my patients who are menopausal, and we talk about this because not only do you increase the risk for urinary tract infections and vaginal infections like BV or yeast, but it is important that people can still experience a healthy sex life. Like it's important. So, we want to make sure that sex is not painful, that people are not, having tears and bleeding and all this sort of stuff during the perimenopause and postmenopausal phase. So I love vaginal estrogen, and even folks who have had personal history of breast cancer can use vaginal estrogens safely. So the thing that's sort of scary to people is they see this black box warning that has to go on every estrogen prescription, no matter what the preparation of estrogen it is. It has to go on there if it's to be FDA approved. And so people they'll get home with their little box of vaginal estrogen cream, take the tube out, and they see this black box warning, and they're like, I can't take this. So I do a lot of education with women about that to let them know that, hey, vaginal estrogen is safe. We're working just at the vagina. We're working locally. So a minuscule, negligible amount, actually absorbs into the tissues. For one thing, after menopause, the vaginal canal is not as well vascularized, so it doesn't have a bunch of big, healthy blood vessels down there anymore. That's the whole problem. That's why we're losing losing the health of the tissue, and we're losing vaginal moisture because the blood flow to the vagina decreases so much. And so that vaginal estrogen cream just sort of helps to bring things back. So I certainly highly recommend it. I think it's probably the best kept secret. But one of the other things that really like frost my cookies, as my grandmother used to say, is that many times, it's difficult to get vaginal estrogen cream covered under insurance.
That's upsetting.
Viagra is always $5 at the pharmacy. It's just, it annoys me.
It's so mean.
Yeah. I mean, I'm like, what about women? Like, women need to have vaginal estrogen just as much as men who are aging might need some of the erectile dysfunction.
Especially if you're giving their husband Viagra, then they need some estrogen.
Right. I'm like,
the husband is going to be coming.
It's like $300 a tube. I mean,
really?
Yeah, it's very expensive. And so if you don't have insurance coverage for estradiol cream, I mean, gosh, it's a lot of money to spend, and it can make it cost prohibitive. And so this is a place definitely where I will tap into my compounding pharmacy friends and phone my friends and say, hey, I've got somebody who needs vaginal estrogen. Can you make this for her? And so then you can get, about a 1 month prescription for between $30 and $35 with compounded vaginal estrogen creams.
And I've also learned that it's just over the counter in places, in other countries. So they're recognizing that this is a safe product and that women need this, and they're not making people jump through a bunch of hoops just to get it.
Right. And, people talk about the whole, bioidentical hormone craze, and should we depend on compounding pharmacy? Should we only use FDA approved things? It really depends on the person and what they have access to. So if I need to use a compounding pharmacy, I do. And compounding is really great for when you really need to get a little bit different preparation or dosage for a patient than what's standardly on the market. So if I need to really tweak somebody's levels and I want to order a very specific dosing, then compounding is great for that. I will just use the caveat that if you are planning to use a compounding pharmacy with your physician, you want to make sure that that's a reputable compounding pharmacy. The difference between FDA approved meds and compounding meds is that there is a 20/20 rule for the FDA. So the medicine has to be within 20% of the strength that it's, so let's say you're doing 1 milligram estrogen tablet. There could be 20% less than 1 milligram, or there could be 20% more than 1 milligram, but it cannot vary any more than that for the FDA to approve that particular brand of medication. Those same rules do not apply to compounding pharmacies. So you can have some variances there. And that's why I say a reputable compounding pharmacy that you and your provider trust is very important. And many compounding pharmacies have, a great deal of integrity. I don't believe that they're just out to try to, scam you out of your money. They're giving you a 1 milligram dose that's really only half a milligram. It's not, I don't think that most pharmacies are doing that, but you do have to, do your homework, do your research, and make sure that, you're dealing with a reputable compounder.
Now, because the dose of estrogen is so small in estrogen cream, if you do still have your uterus, do you need to take anything to balance that with, I don't know if it's progestin or progesterone, but do you need to take that to balance it out?
No. So you can just do your vaginal estrogen cream, and that is fine.
Okay. Now, in terms of forms of HRT, it seems like the pill form is the most reasonable as far as pricing. But I was listening to someone say that she doesn't love to prescribe the pill because it has to go through the liver first, and she'd really rather do the patch. So, and then someone else said they don't really love the pellet because if you have someone that were to get like an estrogen fed cancer or something, well, now that pellet's in the body feeding on that. So I don't know what you think about that, but I feel like I would like to do the patch, but then there's a downfall of that because they said it can be irritating to the skin. So anyways, what are your feelings on these 3 different forms?
So I think that each person should use the form that works for them. But I always start with the patch.
Okay.
If the patient doesn't have an allergy to adhesive, I start with the patch because it is transdermal and it's easily absorbed. There are also, at compounding pharmacies, they can make you lotions and creams that you actually just rub on the skin.
Okay.
So transdermal is actually the safest way to replace hormones. And we know that because it doesn't have to go through the liver.
It's curious to me that a patch, like transdermally, they can regulate the same way they would a pill, that you're only going to absorb 1 milligrams worth or whatever.
Yeah. So the patch actually is really just sort of giving you transdermal estrogen or estrogen and progesterone if you're using a combined patch. And it goes directly into the skin and into your bloodstream that way. Versus when you take it orally, it has to go through the stomach, it has to go through the intestines, it has to pass through the liver before you're actually able to absorb it. So the patch is actually more bioavailable for you.
Oh, okay.
So you can get more out of that patch. And we know that folks who, may be aging may have some liver dysfunction already. And liver dysfunction with hormonal therapy is not always awesome. So like people with liver disease shouldn't take birth control pills. They shouldn't take combined estrogen progesterone preparations orally. So this sort of bypasses the liver, and then you don't have to worry about, if you have someone who has a little liver dysfunction, you don't have to really worry about, are they going to have problems with the pill?
Right. And so how long are those patches good for?
So most people change their patch out once a week. I do have some people who need a little bit higher estrogen dose, and so they will change their patch out twice a week.
Okay. And is the dosing pretty steady that whole time during the week? Or is it like day 1, you're getting a lot, day 2, you're getting less?
It should be delivered every 24 hours, but probably close to the end of the patch life, you may be getting a little less. And so that's why I have some people on twice weekly patches. If they're like, okay, I put my patch on Sunday and by Thursday I'm dying.
Oh, okay.
So we might need to to change that patch. As far as the pellets, that's also under the skin, which is sort of how the patch is delivered, but you just can't take it out. So once it's in there, it's in there and it's got to dissolve, and then you go back and have new pellets placed. And so that's the one downside of the pellets. But I have people who swear by the pellets, like they love them. They don't want their hormone replacement therapy any other way. They want those pellets, and they want them now. So you can't.
Okay, and so you wouldn't necessarily be afraid of like feeding a breast cancer or something with that.
Well, I have not ever in my experience seen that happen, but it is definitely a realistic concern. Like,
Okay.
if someone has a small breast cancer that you have not identified yet, and then you're putting pellets in every few months,
Okay.
you very well might be feeding that. But if they have an estrogen receptor positive breast cancer
Mhm.
and they're taking estrogen by mouth or they're taking estrogen with a patch, you're still
True.
adding additional estrogen that would not otherwise be there. So, it
Mhm.
kind of, and the problem, I guess, is once you sort of know what you're dealing with, and you have an estrogen sensitive cancer somewhere in the body, then you can remove the patch. And the
Hmm.
half life is probably going to be somewhere a couple of days or whatever,
Hmm.
and it's going to go away. But once the pellet is there, it's there. So
Mm.
that's really the only difference. You can stop a pill, you can stop a patch, but the pellet is going to be there until it's fully absorbed and
Okay.
dissolved.
Okay.
So,
Well, I could pick your brain on hormone therapy all day, but like I said, I have 2 doctor's appointments set up, so I will let us move on in the podcast. But thank you for
Oh,
answering those questions. I really appreciate it.
yeah, absolutely. Absolutely. And if you want to get some more info from experts, I have a playlist called Hot Girls,
Oh,
Perimenopause and Menopause on my YouTube channel at Delivering
you
Joy
do?
MD.
Oh,
So
great.
you can check out the whole playlist we talk about everything from hot flashes to what exactly is happening at the level of the ovary to how to just manage the mental part of menopause because that can be really serious for some women, like that brain fog, the not
Mm-hmm.
being able to recall their language, like just trying to talk,
Yeah.
can be sometimes
right.
Not being able
difficult.
to talk.
Yeah.
Yeah.
Forgetfulness, like
Yeah.
it's very stressful. And in many women, it can precipitate depression and anxiety, like 'cause they just really don't feel like themselves and they don't know what's happening to them.
Well, this is great, Joy. Thank you.
I know, I know. We could really talk about so many things here. I would love to turn our podcast a little bit more personal to you, Joy, as a woman. I know that I have seen on the outside that you have been going through your own personal health journey, and I would love for you to kind of speak about that for a minute. Tell us a little bit more about you and your personal health journey.
So, I obviously am a traditionally trained physician who spends a lot of time talking about healthy decisions and what we should be doing. And I had to sort of come to terms with the fact that I was not living a healthy lifestyle. I've been very busy since I got here to LaGrange, and so we had some challenges with, having enough providers just to kind of take care of all the patients who needed to be seen. We had some people retire, some people have some health challenges. So it just got a little crazy. So I was just working a lot, working, 24-hour shifts, then working in the office and just working way too much and not eating well and not taking the time to exercise, not taking the time to do things for myself that are important, like go to the doctor, um, you know, spend time with my family, do things that actually spark my happiness and creativity. And so I realized that I was really becoming burnout. And so, what I ended up doing was just deciding that, hey, I've got to get myself together here. Like, I can't be here for all these people if I am, breaking down myself. It was a rough last few years. I went through just kind of a pretty awful divorce. I had some health problems, and so I was like, okay, I'm coming out the other side of all of this, and what do I want the next chapter to look like? So I just decided that I'm going to start moving my body, start
Mm-hmm.
eating better. And for me, my lifestyle is a little nuts because I, have my practice. I don't take like a lot of call at the hospital anymore, but I do a lot of speaking engagements across the country. So I'm often on the go. And so I just decided to do things that work for me.
Mm.
So, using different apps, attending group fitness classes to make sure that I get my exercise in at least 2.5 hours per week, just like I tell all my patients.
Mm-hmm.
I started using some pre-planned meals. I love them. They're called factor meals, and you just pop them in the microwave for like 2 minutes. but they're pre-portioned. You can do low carb, you can do vegan, vegetarian, or, just low calorie. So I started just doing that and just decided that it was time to lose some weight. It was time to get in better shape, time to start resting, sleeping. At least 8 hours a night. That's something that has been huge for me. It has changed my whole life. So the life of an OB is pretty hectic a lot of the time. But now we're very fortunate at our local hospital to have a laborist group. So these are folks who are in the hospital 24/7, and they take care of your patients after hours and on weekends.
That's neat.
And so that has been a work-life balance that we desperately needed here. So that has really become really helpful. It's been helpful for me. And so I just have been really focusing on my journey and really paying attention to my diet, my exercise, my sleep, and my stress levels, and really working to balance those. And so work-life balance has become huge for me. At my new clinic, Renew Infusion and Wellness in LaGrange, we are using, we have weight loss programs, nutrition programs. And I think that that's something that we really need. We need care that can address the whole woman. And there are some aspects of traditional medicine that I think sort of leave out the important things like sleep, stress, family history. So there's some things that I've always felt that we could incorporate into practice that, that we don't usually offer at traditional doctor visits. And so that's really why I was so passionate about Renew, because I think that it's sort of, I call it a health enhancement clinic. So it's those things that maybe you won't get at your physical or your regular doctor's appointment, but we can help you with those things. And sort of the things that you talked about, Marie, with the quality of life. Like I want to feel good. I want to look good. I want to have like just those extra things that make me feel like myself as I approach a certain age. And so we do a lot of IV vitamin infusions, which is so much better than taking vitamins by mouth because, again, the bioavailability is much higher. So we put it directly into the bloodstream versus you having to swallow it. It goes through your stomach, it goes through your intestines, it goes through your kidney or liver, depending on what supplement you're taking. And then, unfortunately, about 80% of it ends up in your toilet because you can only absorb so much through your gut, but you can absorb way more through IV.
Oh, that's interesting.
So we do all sorts of like immune boosters, energy boosters, even a memory and brain function booster. So we have lots of vitamins that can help you if you're, having a hard time and you want it more of a natural route. But we also offer all sorts of hormone replacement therapy there as well, and weight loss and Botox and fillers and just pretty much anything you want to do to just be an adjunct to your health. It's a lot of fun.
It's interesting to me that you said that work-life balance became very important to you. And then it sounds like you started a new clinic, but it sounds like this is one that's really feeding your joy.
Right. Yeah. And that's exactly it. It feeds my joy because there are certain things that I know people are struggling with that I just don't have time to address in a 20-minute office visit. So, we have time. We have functional medicine care available at Renew. So you can actually like look at your entire body. Like what are my vitamin stores looking like? What are my hormones looking like? I want to sort of get myself better balanced. I want to look at my sleep, at my, at how I'm managing my stress. I want to look at what things in my diet might be triggering some of these health issues that I'm having. So we spend a lot of time with patients at Renew. So every appointment is at least an hour versus
that's awesome.
In my clinic, I'm like 15 to 20 minutes is all we got.
Sure.
So this is a chance for me to really dig deeper and to do some additional health therapies.
Marie, you can imagine my excitement that this has opened up right down the road.
I know.
For me.
They're so wonderful.
Bryce, are you listening? Christmas is coming.
Yes, we can get you a gift certificate. I'll bring it right to your office.
That's right.
Well, Joy, I'm excited. I'm excited that doctors are starting these kinds of clinics. Like one of the clinics that I'm going to this fall is one that is just devoted to the menopause woman. And so I made an appointment with my regular gynecologist, but I also made an appointment with this other one because I know if I just go to the regular doctor, I'm only going to get that 15 maybe minutes, and I'm not going to be able to ask all the questions. I do want to compare what they both think, but I'm excited that when I go to this other one, I think the first consultation is an hour. So I really feel like there's the need for both, like the new clinic that you started and also your regular clinic that you work at.
I totally agree. And I think Mindy and I were chatting about this, and I was telling her that only 1 in 5 OBGYN physicians received adequate menopause training in residency. I certainly believe that OBGYNs want to help their patients. They want to be able to do what's going to help their patients most. But there is a paucity of education. You have to really seek it out. So it's not something that we just were trained in medical school and residency. And it is becoming the new frontier in terms of research and development. So, there are lots of new drugs that are in development. There is tons of research going on. There's lots of advocacy around menopause happening right now. And so we're sort of coming into our own. And there are menopause specialists. You can be certified through the North American Menopause Society in menopause care, but it requires you to take, continuing medical education. And so, I always tell people a second opinion is always great, especially if you can find someone who specializes in menopause, because while your OBGYN is great and they're going to try to do all of the things that you need, screenings and preventive testing, but they just may not be well versed in it. I know I had to really go and talk to colleagues that I knew were very, very well versed. I had to go to some conferences. I had to, do some continuing medical education to be able to get, and I still would say I'm a baby menopause doctor. So I think it's important to find someone that specializes in menopause care, particularly if your quality of life is being significantly affected.
Yeah. Well, that's great. Thank you so much for being willing to answer our questions. I know that this will be super helpful to listeners because even if I just hear about something like the vaginal estrogen cream, I never even heard about it. But then I went into like a deep dive of, what is this? And now I can ask better questions of my doctor when I go. So even anything they hear on this podcast might lead them to then search it out. So I just appreciate you sharing all of your knowledge. It's really wonderful.
Oh, it's my pleasure. I love to talk and I love women's health. So combination.
That's awesome. Yeah, that's awesome. Listeners, you can come and find us on Instagram this week at Midlife Matters Podcast, or you can email us at midlifematterspodcast@gmail.com. We certainly will forward on any questions or comments that you have for Dr. Baker. And we just appreciate her coming on so much. But before we go, we want to do I'm a Fan. All right, Dr. Baker, before we go, we always do I'm a Fan. It's something that we are loving, like a podcast or a book or a product. And so I'm interested to know what you are loving right now.
I would definitely say I am loving the opportunity to do something different with my new clinic. And so my favorite thing right now is this B vitamin Get Up and Go infusion.
Oh, yeah.
It is it really boosts your energy. So I'm a huge fan of that. And we're able to do that with IV hydration, but you can get a shot of what's called Vita B. And that has been amazing. So I've been just bouncing off the walls since I started that. So that's something I'm definitely a fan of.
That's a personalized endorsement because you can definitely feel the effects.
Yeah. I was like, well, I wanted to try each of the infusions before we actually did it because there are different formulas you could use. And so I was like, well, what if I put 2 mls or what if I put 3 mls? So I've been trying them at different formulas to see how I feel after. So I've been my own guinea pig. But awesome. I really, that's my new thing.
Okay.
I can see this as when Abby comes home to visit, instead of going to get pedicures together, we're going to go get a vitamin B infusion together.
Yes.
Yeah. I mean, we have people that come in together and the chairs recline and they heat and they will massage and you can put your feet up and lay completely back. We've got blankets and TV and tea and coffee and whatever snacks, amazing. Whatever. So
oh my goodness.
Yeah. Very, very zen.
Okay.
The idea.
That's
and
awesome.
It is beautiful. I did get to see it. It's a beautiful facility.
Well, thank you. We're excited about it. I love to decorate too. That's like one of my creative things. So I had a lot of fun trying to like play with the theme of the IV drip. I have all these little drip mirrors everywhere, so you can see like it's just all about IV drips. So it's fun.
That's cool. All right, Mindy, what are you a fan of this week?
All right. Well, in going along with the theme today, I'm a huge fan of managing stress. And one of the ways that I have done that is on a recent podcast that we recorded with Julie. I think it was our fall episode. I happened to mention that my daughter, Abby, was in charge of the turkey this year.
Oh, yeah.
Well, the funny thing is I didn't tell her this. She happened to hear the podcast.
She's like, what?
She said she responded verbally by herself out on a walk as she's listening to me say, oh, yeah, I'm going to put Abby in charge of that. And Marie, she said, and you and Julie fully embraced the idea. And we're like, yeah, you just need to like rip the Band-Aid off and get Abby in charge of that. So she called me and told me about this. So yes, Abby's in charge of the turkey. I happen to be a fan of this podcast that I could tell my adult child that she was now in charge of the turkey. And she heard the message loud and clear. And thankfully, it was a hilarious situation. But I just thought it was so funny and I had to share that.
Oh, that's wonderful. Well, yay. That's a lot of stress off you for Thanksgiving Day. Yay,
yes.
Abby.
Yes.
Yeah. My son, who's a similar age to Abby, has done our turkey at least once and possibly a couple years. And the years that he's done that, it's great. I mean, I love not being in charge of the turkey. There's enough other sides to worry about. All right. You guys are going to be so surprised by this, I think, because I had never heard of this. So this is my I'm a fan. So we recently moved, and of course, there's a lot of home projects, and Steve's busy traveling, and I'm trying to do a lot of them myself. And I talk to my dad when I can, and he'll give me a list of things. But then I have to go to Lowe's by myself. So even after I've gotten the list from my dad, I still don't really know quite what I'm doing. So I just picked once a random customer in the aisle to start asking questions to, just because he looked like he might be knowledgeable. So he helped me all I could. Then we went over to a Lowe's employee and he's like, you know what? I really don't feel like this is my area of expertise. He goes, but why don't you go back to the pro desk in the corner? I said, what? Did you know that Lowe's has pros?
Lowe's pros.
Yes, Lowe's has pros. They have people in the back. It's in ours. It's on the back left corner. You can go up like with the picture on your phone or the project and you can say, where's the stuff for this? How would I put this together? What tools do I need? What am I doing? And they will walk you around the store and help you pick it out.
Wow, that's amazing. I'm glad to know that because I definitely need help.
Yes, it's like taking your dad, who's like a Mr. Fix-It, to Lowe's with you, and they go up and down the aisles, and he showed me like what the molding I needed, what I needed to cut it, like the glue I needed. Like he just walked me through and then checked me out at the station, and then I just walked out the door. So it was awesome.
Wow, I'm definitely going to try that next time. I wonder if Home Depot has, because we don't have a Lowe's in LaGrange, but I think they might have pros too somewhere. But that is very helpful because I'm in there like with my app trying to like search things and find out what aisle and what bay and what, I'm pretty clueless in any home improvement store.
Yes, yes.
Oh my goodness. That's exactly what I need.
Yes, it was awesome. So I would just say that if you are in midlife and you are being sent to Lowe's to gather up a bunch of stuff, you have no idea what it is, just head right back to the pro desk and say, can you please help me? And there were multiple men back there. So it wasn't even like I had to wait in line.
That's awesome, Maria. I love it so much.
I thought if my retired father ever needed a job, this would be perfect for him. Like these are the kinds of things retired men need to be doing for the world.
It's true.
Right. That's his contribution after retirement.
Help us women, please. Okay. Well, Joy, we have enjoyed having you on so much. You have been a joy. And I'm so glad that Mindy brought you on. And I know that Mindy's probably going to be utilizing your clinic. And then she'll be telling me about the great benefits she's receiving.
That's right.
Well, I have had the most fun. And so thank you for having me. And I hope that what we talked about today helps some people.
Oh, I'm sure it will.
Very encouraging, very helpful. Thank you so much for your time, Joy. I just appreciate it so much.
My pleasure. Anytime.
All right. We'll talk to you guys next week.
Bye.
We're so happy you joined us today. You can find the show notes for this episode at midlifematterspodcast.com. Also, please tell a friend about the show and help them hit the free subscribe button on their favorite podcast app. Be sure to follow us on Instagram at Midlife Matters Podcast. That's where we post pictures and stories about all the things we talk about in each episode. Thanks for listening, and we'll see you next week.